Welcome to another deep dive. Today, we're looking into a very unique case in feline oncology.
Right.
It's a case report about a 4-year-old cat with a super rare type of bone cancer that spread to the brain.
Yeah.
I mean, even for experienced vets, this is a real challenge.
Yeah.
Nasal disorders in cats, they often have very similar symptoms, which makes diagnosing them really tricky.
Yeah, and what's really fascinating about this case is that this cancer,
Okay.
telangiectatic osteosarcoma, or TOS, it's only been reported twice before in cats. So this report is incredibly valuable to the veterinary community.
Wow. So this cat, initially, it had trouble breathing, nosebleeds, wasn't eating well, and had dark stools.
Yeah.
And these symptoms went on for 2 months before it was even seen by a vet. Then, when they finally examined it, the cat had noisy breathing, blood-tinged nasal discharge, and a low lymphocyte count. It's a real puzzle, isn't it?
Oh, it was. The initial cytology pointed to a malignant mesenchymal tumor, but it couldn't specifically diagnose TOS.
Right.
And this is a great example of why more advanced testing is sometimes needed. You know, things like histopathology and immunohistochemistry to get a definitive diagnosis.
Yeah. And the CT scan really showed just how serious the situation was. Significant nasal obstruction, 90% on the left side and 40% on the right.
Wow.
And during the rhinoscopy, they found a white mass in the left nasal cavity.
Yeah, and despite treatment with dipyrone and methylprednisolone succinate, the cat got worse.
Oh, no.
The breathing problems got even worse. There was discharge from its left eye, and then an ulcer developed on its nose.
That's awful. And then during the necropsy, it was a really grim picture, wasn't it?
It was.
The ulcer on the nose was actually connected to the nasal cavity through bone lysis.
Right.
And there was this dark red mass that had completely replaced the nasal turbinates and was growing towards the larynx.
And most concerning of all, there was complete bone lysis of the cribriform plate. And the tumor had actually invaded the frontal lobe of the brain.
Oh my goodness. So the microscopic exam, what did that show?
Well, it showed a mix of things, you know. It revealed osteoid and mineralized matrix, which are typical for bone tumors.
Yeah.
But there were also these sarcomatous cells around blood-filled spaces, which is a characteristic of TOS.
And this is where a pathologist's expertise is so important, isn't it?
Absolutely, it is.
These blood-filled spaces could easily be mistaken for another type of cancer called hemangiosarcoma.
Exactly, hemangiosarcoma, or HS. And being able to tell the difference between those two is absolutely crucial for the diagnosis and the treatment.
So immunohistochemistry played a really key role here, didn't it?
It did, yeah. It really helped to determine where the tumor originated.
Right.
So in this case, the tumor cells, they stained positive for osteoblast markers.
Okay.
Which means the tumor came from bone.
Right.
But it stained negative for endothelial markers, which ruled out hemangiosarcoma.
So essentially, TOS is like this aggressive, bone-destroying lesion that's just filled with these blood-filled spaces.
Yeah, that's a good way to put it.
And unfortunately, just like in humans and dogs, the prognosis for TOS in cats is pretty bad.
It is, yeah.
Especially in this case, where the location of the tumor, it was just in such a bad spot, affecting vital functions like breathing.
Yeah.
And that led to the cat declining really rapidly.
And that's the burning question. How can we raise awareness about these rare cases among vets and pet owners, too?
Right. Because early diagnosis, even if it doesn't change the final outcome, it could potentially improve the cat's quality of life.
Exactly. You've got
with better palliative care and things like that.
You got it. That's the crux of the matter, finding that balance, acknowledging how rare these cases are, but also making sure that vets are ready and equipped to consider them when they're faced with these puzzling nasal disorders.
Yeah, the details of this case.
Right.
The diagnostic challenges, the aggressive nature of TOS, it's all so insightful, even for someone who's not a vet, you know?
Yeah, it really highlights how connected human health and animal health are.
It does.
The more we learn about these rare cancers in animals, the more we might be able to apply that knowledge to human oncology as well.
Absolutely. So, although tragic, this cat's case really contributes significantly to our understanding of TOS.
Absolutely, it does. And it really reinforces how important continued research is. And collaboration.
Yeah.
And open communication in the scientific community.
This has been a truly enlightening deep dive.
It really has. And although the topic is complex, the insights we've gained are really invaluable.
Before we wrap up, any final thoughts for our listeners?
Yes. Given how rare TOS is and the difficulties in diagnosing nasal disorders, what steps can we take to close that knowledge gap between veterinary specialists and general practitioners? That's crucial to make sure our feline companions are diagnosed accurately and quickly.
That's a great question. So where can vets and even pet owners go to learn more about these rare conditions?
Well, continuing education for vets is so important.
Right.
Attending conferences and workshops, online courses that specifically focus on feline oncology or nasal disorders can provide really valuable updates and insights.
And what about pet owners? They might not have access to those same resources.
True, but that's where reputable online sources come in.
Okay.
Organizations like the American Veterinary Medical Association or the Veterinary Cancer Society, they offer really reliable information for pet owners on a variety of health topics, including rare cancers.
But it's important to emphasize that they should always consult with their vet for any health concerns.
Oh, absolutely.
Yeah.
The internet's a great tool, but it should never replace the expertise and guidance of a qualified veterinarian.
For sure. This case really highlights how important it is to seek veterinary attention quickly, as soon as a cat shows any signs of nasal distress.
Right. Early intervention is key.
Yeah.
Even if it turns out to be something less serious than TOS, the sooner a diagnosis is made, the better the chances of successful management or treatment.
The authors of this report also talked about the need for more research into TOS in cats. Given its rarity, gathering data is essential for improving our understanding and developing better treatment strategies.
Absolutely, yeah. Every case like this one adds valuable information to our knowledge base, which could eventually lead to better outcomes for cats in the future.
This deep dive has been a really eye-opening experience.
It has.
It's amazing how much we can learn from just one single case report.
It is, yeah. It's a testament to the power of observation, meticulous documentation, and collaboration within the scientific community.
We've explored the complexities of feline nasal disorders, the diagnostic challenges of TOS, and the importance of raising awareness among vets and pet owners.
And although the prognosis for TOS remains challenging, these cases fuel our pursuit of knowledge and inspire us to keep seeking better ways to diagnose, treat, and support our feline companions.
Any final thoughts for our listeners today?
Let this case serve as a reminder that knowledge is power. The more we learn about rare diseases like TOS, the better equipped we are to advocate for our furry friends and make sure they get the best possible care.
Well said. From Vet Neurojar, keep those minds inspired, hearts light, and tails wagging.
Yeah.
Makes a lot of sense. So if a vet suspects TOS, what are the next steps?
Well, advanced imaging like CT scans are really important because they can show how much bone is involved and where exactly the tumor is, especially its location in relation to, important things like the brain.
And I imagine biopsy and histopathology are key for confirming the diagnosis.
Absolutely.
Yeah.
Histopathology looks at the structure of the tumor cells, looks for those characteristic blood-filled spaces lined by those sarcomatous cells.
And you mentioned earlier that those spaces could be mistaken for hemangiosarcoma. How does immunohistochemistry help to tell the difference?
Well, it's all about the markers. Immunohistochemistry uses antibodies to find specific proteins in the tumor cells. So TOS cells stain positive for osteoblast markers, which means they come from bone, but they're negative for endothelial markers, which are found in the linings of blood vessels. Hemangiosarcoma, on the other hand, would show positive staining for those endothelial markers.
Got it. So it's a really powerful tool for figuring out the exact type of tumor.
Yeah, it really is. And it's becoming more and more important in veterinary oncology as we learn more about these subtle but really crucial differences between cancers.
Sadly, this report said that the cat was euthanized. Is that a common outcome for TOS?
Unfortunately, it is, yeah. TOS is very aggressive. Often doesn't respond to conventional treatments like surgery, radiation, or chemo. And the tumor's location in this case, invading the brain like that, made successful treatment even less likely.
That's heartbreaking.
Yeah.
But it shows how important it is to have open communication between vets and pet owners.
Absolutely. In these tough situations, providing compassionate and realistic guidance is so important. Helping the owners to really understand how complex the diagnosis is, the limited treatment options, and the likely outcome, that lets them make informed decisions for their pet.
This case also showed the potential for cross-species learning. The author said it was valuable for both veterinary and human oncology. Can you explain that a bit more?
Sure. It's the One Health concept in action. Human and animal health are connected.
Okay.
Discoveries in one field can often help the other. So while TOS is rare in both cats and humans, studying it in animals can give us insights into how the disease works, and that could lead to new treatments for both species.
So even though this case had a sad ending, it adds to our knowledge and could benefit both animals and people.
Exactly. It reminds us that every case, no matter how rare or difficult, has the potential to increase our understanding of cancer and help save lives.
This deep dive has been truly humbling. We've explored the intricate world of feline nasal disorders, explored how to diagnose TOS, and witnessed how this disease affects cats and their families.
And we've seen the dedication and compassion of veterinary professionals who are working to unravel these complex conditions and provide the best possible care for their patients.
Any final thoughts for our listeners today?
Awareness is key. While TOS is rare, knowing it exists and understanding it is the first step toward timely diagnosis and making informed decisions. For vets, this means keeping up with the latest research, and considering TOS when diagnosing cats with persistent nasal problems. And for pet owners, it means being observant, seeking veterinary care quickly, and communicating openly with their vet.
Those are powerful takeaways. Thank you for guiding us through this complex and fascinating case. From Vet NeuroJar, keep those minds inspired, hearts light, and tails wagging.